So, first of all, a few words about the EPMA concept. EPMA is the Association for Predictive, Preventive, Personalized Medicine in Europe. But we are open for any country in the world, and currently under the EPMA umbrella we have not only European countries, but altogether we are 44 countries worldwide, including States, Canada, Australia, New Zealand, South Korea, China, Russia, Ukraine, and many, many other countries. This is the innovation in science and healthcare, because we are bringing three elements together. This is predictive diagnostics, targeted prevention, and personalized treatments tailored to the person. Why it is so important? I would like to emphasize that we are working not only with personalized treatments, because before you start to treat your patient, you should first learn as much as possible about his personal predispositions to any kind of pathology. So for that purposes, you should combine different technologies in diagnostics and to make it as much predictive as possible. And if there is any pathology already established, you should find out as much as possible information as early as possible. So that's why it is early and predictive diagnostic as the basis, which create the robust platform for targeted prevention. Of course, we cannot prevent everybody against everything. It is not possible even from the economical point of view. That's why we should make good use of predictive diagnostics in order to find out what are the individual predispositions to any kind of pathologies and to target their prevention. So the philosophy include both primary and secondary prevention. For example, in diabetes, you know that there are a lot of patient cohorts in different countries. In Europe, it is about 10% of the population. In countries like Saudi Arabia, it is 28% of the population. And we have parts of India, like Kerala, that almost each family has patients with diabetes. So we are very much worrying about these trends in the world, and EPMA propose robust strategies how to make the predictive diagnostics. It means that to learn who has the individual predispositions to this pathology and to start treatment before the onset of the pathology. Because in the case of diabetes, it is not only the problem with the fluctuation of glucose and insulin, it is about development of secondary pathologies like cardiovascular disorders, polyneuropathy, nephropathy, and several types of cancer. All of them are very severe pathologies which we can prevent early, well in time, if we trigger primary prevention. This should be done already latest in teenager age, because now in several countries the new population in the cohort of the diabetic patients, at least 30% are coming from the cohorts of teenagers, and this is really alarming. So it means that we should start with population screening and primary prevention as soon as possible. This is also good for economy of the healthcare system, because by this way we can really save money instead of to wait until onset of the pathology and to treat only sick people.